A warm welcome to all those interested in yoga and health. More and more research is now being devoted to see how the vagus nerve is so essential for our survival. In fact, how yogic practices are helping to increase our vagal tone are now being defined. This talk is largely devoted to understand the link between yoga and the vagus nerve. Now, before embarking on this topic of the vagus and its role in yogic practice, a brief about some anatomy and physiology of our nervous system is essential. There are many body activities for which we have no direct control. Activities such as the heart rate, blood pressure, respiration, body temperature, digestion, metabolism, fluid balance, etc., are being controlled automatically by what is known as the autonomic nervous system. They are all occurring without our conscious effort. And all these activities are kept within a constant range by two opposing forces within the autonomic nervous system. Homeostasis is said to exist when these two forces balance each other to maintain the internal environment. If one force, say, increases the heart rate, the other force tends to decrease it. These two opposing forces are known as the sympathetic nervous system and the parasympathetic nervous system, and these two secrete different neurotransmitters at the nerve endings with opposing actions. The sympathetic system nerves emerge from the thoracic region of the spinal cord to supply all the body organs. This is also known as the thoracic outflow. This system activates the flight or fight response during a threat or perceived danger. It is therefore mainly responsible for arousal. It thus causes the heart rate, blood pressure, respiration, blood sugar to increase if there is anxiousness and tension. The parasympathetic system nerves emerge from the junction of the spinal cord and the brain, and also from the lowest portion of the spinal cord. Together, they are known as the craniosacral outflow. It primarily stimulates the body's rest and digest and the feed and breed responses. It thus restores the body back to a state of calm or relaxation. The majority of the parasympathetic distribution in the body is by the 10th cranial nerve called the vagus. It is unique in the sense that it not only supplies a small area of the external ear, but innervates all the organs coming across its long course down from the neck, chest, and to the abdomen. The parasympathetic supply to the palate, pharynx, larynx, esophagus, lungs, heart, and abdominal organs, namely the stomach, spleen, pancreas, liver, gallbladder, small intestine, and colon, is via the vagus. Now, when the vagus gets stimulated, it slows our heart rate and our breathing. It improves our gut health and it calms our nervous system down. Researchers refer to this as increasing the vagal tone. It is also now well recognized that as the vagus nerve descends, it gives off branches at several key locations to form a network of nerves called plexuses in front of the spine, which we now recognize as chakras. The first of which is the pharyngeal and laryngeal plexus in the neck, which is known as the Vishuddhi chakra, followed by the cardiac or pulmonary plexus in the chest, the Anahat chakra, and in the abdomen as the celiac plexus, which is known as the Manipur chakra, and for completion's sake, the sacral plexus and coccygeal plexus, which are formed from the pelvic nerves, that is the sacral parasympathetic outflow, constitute the Swadhisthana and the Mooladhara chakras. Homeostasis is invariably disturbed when there is sympathetic hyperarousal or parasympathetic hypoarousal. Various disorders are known to be occurring because of this imbalance, and parasympathetic or vagal stimulation seems to be the remedy. Thus, CVS disorders, mental health issues, neurological disorders, altered immune status, gut health issues, and conditions as diabetes and Parkinsonism can be helped by vagal nerve stimulation. So, how can we stimulate the vagus nerve? Though there are many unconventional ways and direct neuromodulation techniques like vagal nerve pacers, today's talk is confined to various yogic manipulations for stimulating the vagus nerve. These could be grouped into Sukshma Kriyas, Pranayam, and Yogasanas. Certain Sukshma Kriyas, while beginning a yoga schedule, can be seen to stimulate the vagus. Some pertinent among them are neck exercises, of which neck lateral bending are very useful. In the neck, vagus nerve passes in front of the tight scalene muscle and behind the sternocleidomastoid muscle. Gentle stretching of these muscles in the neck tends to produce a relaxation response through engagement of the vagus nerve. There are certain eye exercises in which relaxing the muscles in the eyes engages an innate reflex called the oculocardiac reflex, which initiates a parasympathetic response to slow down the heart rate and lower the blood pressure. This reflex can be stimulated by cold eye water washes or with gentle pressure on the eyes, which can have a calming effect on the nervous system. You can thus relax your eyes by placing palms over the eyes and applying light pressure. One can also stimulate the vagus nerve by repeatedly converging the eyes on a nearby focal point and then shifting to a distant focal point. This is called the oculocardiac convergence reflex. Hold a pencil, a small object, about 4 to 6 inches in front of your face. Allow your eyes to focus on this object for about 20 to 30 seconds. Shift your focus look off in the distance for about 20 to 30 seconds. Continue back and forth for about 4 cycles and then softly relax your eyes. Next kriya is massaging the auricular branch of the vagus. The external ear is the only place on the body where the vagus nerve sends its only peripheral branch, the auricular branch of the vagus. The middle region of the pinna, the cymba concha in particular, is mostly innervated by the vagus nerve. Gentle massaging with the fingers in front and behind the pinna of both ears tends to activate the vagus. Pranayam procedures are connected with our breathing techniques and they have a remarkable effect in increasing the vagal tone. Respiratory activity is primarily an unconscious effort, and the inspiration to expiration ratio is generally 1 is to 2. Stimulation of the upper and lower airways by the flow of air currents during breathing stimulates the autonomic nervous system. During inspiration, the sympathetics get stimulated, and during expiration, the parasympathetics. However, when we consciously breathe, we can further engage our diaphragm by deep inspiration and alter the rate of respiration by increasing the expiratory time. This we can call controlled or regulated breathing as opposed to the involuntary breathing. First, we will discuss what is diaphragmatic breathing It is also known as yogic breathing, and it is a form of controlled respiration. Yogic breathing combines abdominal or diaphragmatic breathing, thoracic or chest breathing, and clavicular or upper chest breathing. Take a deep breath, that is inspiration, allowing the abdomen to expand fully. Then start to expand the chest outward and upward. And finally, inhale a little bit more until expansion is felt in the upper portion of the lungs around the base of the neck. This completes one inhalation. The whole process is one continuous movement, each phase of breathing merging into the next. During exhalation, allow the upper and lower chest to relax and then try to empty the lungs as much as possible by drawing and pulling the abdominal wall as near as possible to the spine. The exhalation should be slow and hold the breath for a few seconds at the end of the exhalation and then start the next inhalation. Slowing down and giving resistance to your exhalation trains your body to use the diaphragm. During deep breathing, the tidal volume may increase 4 to 5 times when compared to the tidal volume when asleep. Oxygen intake and carbon dioxide removal is thus improved. If, when we inhale, the belly moves out and when we exhale, it contracts, then one is performing diaphragmatic breathing properly. This breathing improves lung function and cognitive functions, lowers cortisol levels, and lowers the blood pressure by stimulating the vagal nerve endings in the lungs. The next most important pranayam is Nadi Shodhan. This is deep breathing with one nostril at a time, inhaling by left nostril and exhaling by right nostril, then inhaling right nostril and exhaling left nostril. This pranayam is similar to Anulom Vilom, but the respiratory cycle here is constituted of 4 steps. This is known as box breathing. First is inhalation, second is breath hold, third is exhalation, and fourth is the hold after the exhalation. Each step is of 4 seconds and are in proportion of 1 is to 1 is to 1 is to 1. Observe the demo of one cycle. Inhale left nostril, hold, exhale right nostril, hold after exhalation, inhale right nostril, hold, exhale left nostril, hold after exhalation. Subsequently, the inspiratory hold and the expiration time are gradually increased in subsequent breaths in ratio of 1 is to 2 is to 2 is to 1. This pranayam lowers stress levels, reduces anxiety, and improves sleep, producing a calm and relaxed feeling in the mind and body. It lowers blood pressure, reduces pain, and stimulates brain cells by increasing vagal activity. Ujjayi pranayam is a form of deep breathing with inhalation and exhalation being attempted via a partially closed glottic opening. This can be achieved as follows. Tense the pharyngeal and neck muscles by rolling the tongue and touching its tip to the soft palate. Then close the mouth without approximating the jaws. Subsequently, partially flex the neck as in Jalandhar Bandh to further narrow the airway passages. Start abdominal breathing through the narrowed laryngeal inlet. The breath sounds are similar to ocean waves, and the pranayam is generally known as oceanic breathing. During Ujjayi pranayam, you can feel that the inspiration and expiration are taking place at the level of the glottic opening. The glottic opening is richly supplied by vagal nerve endings, and they tend to get stimulated by this pranayam. Numerous benefits have been attributed to this pranayam. The pranayam helps in controlling tension and anger and giving peace of mind, apart from controlling the heart rate and blood pressure. Today, the last pranayam to be discussed is the Brahmari. Brahmari pranayam stimulates the vagus in three ways. Firstly, pressure on the tragus while performing this pranayam stimulates the vagus, which is innervating this part of the external ear. Secondly, pressure on the eyeballs tend to activate the oculocardiac reflex. And thirdly, the prolonged expiration and resonance created while exhaling with a humming voice is sensed by the vagus, which supplies these upper airways. Now, let's consider yogasanas and their connection with the vagus nerve. The vagus nerve, as already explained, is responsible for the formation of the Vishuddhi, Anahat, and Manipur chakras. Stimulation of these chakras by the various yogasanas undoubtedly benefit us by connecting our body and mind with the help of the vagus nerve. Some examples that are quoted are the Vishuddhi chakra, which is stimulated by the Sarvang and Setubandh asana, the Anahat chakra by the Ushtra asana, and Gomukh asana, the Manipur chakra by the Pavan Mukh, and Dhanurasana, laughing, singing, humming, chanting mantras are known to activate all the chakras and thereby the parasympathetic nervous system, of which the vagus nerve is a major component. Thanks to the vagus nerve.